Hello, my name is Diane, and this is The New Old Nurse. I've decided to film today's vlog outside in sort of my backyard just because it's so pretty out today. Fall is my absolute favorite season, and the weather is gorgeous, and I just thought the light was so pretty out here, so change of scenery. Welcome to today's vlog. Our topic today are the absolute top things I hate about nursing. I came up with a list of 7 things. I probably could have kept coming up with more, but those 7 came to me kind of off the top of my head. And I actually love being a nurse, but there's just some things that are sometimes hard to take in this field. And I thought I would share my top least favorite things, top things I hate about being a nurse. The first thing I hate is 12-hour shifts. Overall, I love the schedule that 12-hour shifts gives you because you work less days. But a 12-hour shift is a long day. I apologize, by the way, for any car noise you might hear. 12-hour shift is a really long day. It's particularly difficult when your coworkers who work 8-hour shifts, where I work, the CNAs work 8-hour shifts and the nurses work 12, when they're going home at 2 and you still have hours and hours left. Add that 12-hour shift to, time to give and get report at the beginning and at the end of your shift, to your commute. And I am easily working from the time I leave my house till the time I get back, 15-hour days. And I sometimes do 3 of those in a row. So it is exhausting. And I don't want to give up my 12-hour shifts, but I still hate them. To kind of piggyback onto that, the next thing I hate about nursing is just how physically exhausting it is. Yes, I think it's partially because it's 12-hour shifts, but it's also because you're on your feet. You're doing physical things. You're lifting people. You're transferring them. You're doing stuff. You are not sitting at a desk. For the most part, you're not sitting at a desk. And I know there are nurses out there who have jobs like that. I do not have a job like that. And just, you're weary at the end of the day. When I get in my car, when I first leave work, I'm not actually that tired. I'm kind of still wired, I guess, from the day and coffee I had at 3 o'clock in the afternoon and things like that. But once I'm about half an hour away from work and I think all the adrenaline leaves my body, I just realize how tired I am, that my feet hurt, and I'm just starting to get weary. And because the days are long, by the time I get home and maybe have something to eat and change and whatever, it's basically bedtime. So it's just a really tiring job. I always think if you work 3 shifts in a row, you need a 4th day to totally just physically recover. I give myself grace whenever I do 3 shifts in a row, that the 4th day after those are over, I can stay in my pajamas all day and not feel guilty about it, because you're just tired. You are physically and mentally exhausted from nursing. The next thing I hate about nursing is working weekends and holidays. I have had coworkers who don't mind this at all. Some of them love working holidays because of the extra pay. Where I work, we don't get extra pay for weekends. There's no shift differential. We do get time and a half on holidays, although it's not every holiday. It's, the exact federal holidays. So for example, if you work Christmas Eve, that's not time and a half, even though your family might celebrate on Christmas Eve. The day after Thanksgiving that a lot of your friends have off to go shopping, if you work that day, there's no extra pay that day, even though it feels kind of like a day that a lot of people have off. New Year's Eve is not a holiday where you get extra pay. New Year's Day is. So to me, the extra pay, a lot of the holidays, so-called, holidays to me that I work, there is no extra pay. I also think it's a little bit to do with my age, that I think more about life and the time I have left. And not that anybody knows how much time they have left, but my parents are older and I have a grandchild now, and I think about the sheer number of Christmases that I have left with some of the people who I love. And I think to myself, it really sucks to be at work instead of with my family on these days. So I hate it. I hate working holidays. It's the same thing with weekends. My husband works Monday through Friday. Saturday and Sunday are the only days he has off, and I'm working half of them. And it isn't the nature of the job. I appreciate very much that my residents, my patients, need care 7 days a week, 365 days a year. So I certainly don't begrudge them needing the care. But you will find me complaining working weekends and holidays. I just hate it. I've always hated it. If I get a nursing job where I got all those particular days off, or, I would take it in a heartbeat. But it's just, you got to take your turn, and I don't like taking my turn. One thing that I don't like about nursing, which I don't hear too many people talking about, but because maybe they don't care, but I don't like that it's female dominated. And when I say that, I just mean like it's the vast majority of coworkers you're going to have, bosses you're going to have, are going to be females, at least in the jobs that I've had. Not that there's anything wrong with females. I myself am one. My mother's one. My daughter's one. But I think that you can get a different perspective, and a different energy, and just a different way of being when you have male coworkers in the mix. I don't mean that I care about which gender my boss is or which gender the nurse I'm working next to that day is, but just overall, it would be nice to have some different perspectives. And I wish more men would go into nursing or CNA work. We have so many patients who are men, who love and respond to our male coworkers so well that I just wish there were more of them. I mean, I don't think there's anything we could do about that. That's just kind of how it's always been for nursing in certain fields. But it's something that, I have worked in other industries that were male dominated. I worked in industries that were kind of more of a mix. And I just think when there's more of a mix, it's just overall, I like the energy better. Another thing I hate about nursing is that really one of the only ways to get more pay besides just leaving your job is just to kill yourself and work more hours. Yes, the opportunity is often there, which is nice, but a lot of nurses who you see online who are saying I'm making $150,000 a year, unless they're in California, is because they're working 5 12-hour shifts a week. And is that their choice? Yes. Can they do it? Sure. Can I do it? No, I cannot be a nurse for 60 hours a week. I am too tired. I don't feel like I'm as efficient. I don't feel like I am as careful. I don't mean I'm purposely not as careful, but I just think when you are tired, you just are more prone to making mistakes. So I just think it's kind of something that a lot of people think, oh, you can make so much money as being a nurse because you can work a ton. Yeah, that you can. That's kind of one of the only ways to make a lot more money being a nurse. If you get further your education and go into management and things like that, of course, just like any other industry, those are ways of increasing your pay. But the fact that you have to kind of physically kill yourself to get a good increase in income is something I really hate about this job. That it's like, oh, well, you need more money. Oh, well, you gotta never see your family for 5 days and work until your fingers bleed. I can't do that, not at my age. And I just think it's unfair that that's what we have to do to get enough money, a lot of people to get enough money to even take care of their families. One of the situations I hate dealing with the most in nursing is unrealistic or overly demanding families. And I think if you're a nurse, you know exactly what I'm talking about. But particularly with the population that I'm typically working with, which is older, geriatric, a lot of 80-plus-year-olds, a lot of the families are in denial about their parents or uncles or grandmothers, whatever age, and what can realistically be done for them. Everybody thinks that everything should have a cure, and regardless of what the patient does, it doesn't matter. We should find a way to work around that. I don't know. It's hard to be really specific about this because I don't want to violate any HIPAA information or anything. But, I've had residents who are almost 100 years old and the family doesn't want to give them pain medication because it knocks them out and we're trying to kill them. And I don't know. I just think that I understand loving someone and I understand losing someone. And as a nurse, you see that in your job every day. I hope I never become callous and uncaring about those people and their loved ones. But also sometimes I think it's just so hard because you have to advocate for the patient and what they might be feeling. But the families just don't want to hear it. They don't want to hear it. They think that if you just give them this right combination of medication, or if you just do this certain thing at this certain time, they're gonna live forever. I really think some of these people think their relatives are going to live forever. And even having a conversation about a do not resuscitate order, there are families that are hesitant about it even when their relative is 98 years old. if you're not a nurse or don't work in the healthcare field, you might think like, well, what, of course, why wouldn't you do CPR on somebody who is 98 years old? Without getting too graphic about it, it's probably not going to work. The CPR is probably not going to work in any meaningful way where the person will come back from the dead like you see on TV and they'll be themselves. It's really just more physically hurting them and for not any payoff because they're still not going to make it. That's just a specific example, but overall dealing with families, I think you can tell I'm going through this right now, which is why it's on the top of my mind. But you know what? I love these families. I know them. I care about them. I love their relative who I've been taking care of, but it's just like, please come to reality with me. Please come to reality with me. People pass away. Please let us make them comfortable when they pass away. You know, I always think that if I go back for my RN, it would be to become a hospice nurse. And I think to myself, why would I ever do that? Because I'd just be bringing more of these situations into my work life. But, you know, just, and I'm sure people see it at every age, in every situation, but it's very difficult dealing with these families. And the last thing I hate about nursing, certainly not the last, but the last I'm going to bother to mention here, is how staffing directly affects your work. You know, maybe in other jobs that I've had, you can sort of shut your office door and just take a minute and it doesn't affect anybody else, because they're kind of like doing their own thing independently. If you leave early for the day, it might not affect anybody else that directly. They'll just see you the next day and you'll get to it then. With nursing, everything has to be done in a timely fashion, meaning when you get into work, there is no just browsing the internet or checking TikTok for 90 minutes before you get started with your day. Like, you have to get started. Medications are due. Things have to be done. So if somebody doesn't show up on time, you can't do your job. Like, you really can't do your job. If we're short staffed, if somebody doesn't show up at all, I'll give an example. If my coworker shows up late, even half an hour late, for that half hour, I'm basically covering their people for the most part. Yes, the night nurse might still be there. Sometimes they take off. You know, you can't control what other people do. So instead of having just my patients, I have double the number of patients until that person gets in. That's hard. That is a pain in the ass. I hate that. I always try to be on time because I don't want to put other people in that situation. If, you know, you don't come into work because you're legitimately sick, I get it, but it's screwing the other people over. And it does make it hard too when you want to take time off or you have to do something and you know you're going to leave your coworkers who you love in a lurch. It's really hard to be okay with that. But I haven't really had another job that has so directly what the other people are doing affects me and the ability to do my job or affect my direct workload. If you have like kind of a desk job, like I said, a lot of things can maybe be put off till later when the person shows up or the next week when they're back from vacation. Oh, they're not here till next week. This project can wait until next week. With nursing, oh, somebody wants to take the week off. Oh, okay. Well, somebody absolutely has to agree to cover, or they have to call agency, which could be a nightmare, or your boss is working on the floor with you for a week while that person is off. There's basically no good solution when somebody's not there. And again, I don't think it's unique necessarily to nursing, but it happens a lot. We work hard, we're burnt out, we work long shifts, so it just feels like it's almost a daily thing you have to put up with. And it's something, I guess, I knew that staffing was an issue in nursing. That's partially why there's always jobs available, which I do love. But gosh, it can make it hard to do your job under those circumstances. Okay, I think that's my list. I'm going to stop there. I could come up with a ton more. I don't want it to seem like I hate nursing. I don't. I love it. And I am somebody who can complain about anything. So keep that in mind. But nursing does have a lot of stressors, probably some unique stressors to nursing or healthcare. And I'm glad I got them off my chest. If you have any other comments or questions, or you want to share the things you hate about nursing or your job, whatever that may be, please share them down below. Until next time.